So in 2024, there was a survey that was done that suggested that 51% of infertility in the UK was being pushed to the background by medical health professionals. What we're going to be doing today is we're going to be talking to Dr. Daniel Marcu, who's got a company that is trying to help resolve a lot of these infertility problems in male. And obviously, he's going to talk about the male healthcare in general. This is going to be a very good conversation, and I'm hoping all of you will pay attention to it, because I've heard stories about how ovaries do age differently, but I barely hear stories about the fertility rate in men and how it's being dealt with in the UK. So I don't want to do so much of the introduction. I just think I will leave it to him. I've got the award-winning scientist, Dr. Daniel here, but then he will do obviously all the introduction that is needed. By the way, congratulations for the award that you just received for your innovation. Just introduce yourself, let people know what you do and who you are, and let's just jump right into it.
Great, thank you so much for the invite. By the way,
you're welcome.
So I'm a scientist and researcher by background. I've spent probably the past almost 9 years working in the field of reproductive medicine, and I started very much like a scientist. I did an undergraduate degree in biomedical science, and then I liked genetics a lot, so I then ended up studying prenatal genetics and fetal medicine at UCL. And within UCL, I was taught about fertility, reproductive health. But the conversation was always about women, as you just said in the introduction, and that led me to really start thinking about, why are we not talking about men, essentially? And as part of that personal questioning and I guess desire to learn more about the topic, I decided to apply for a PhD in Sperm Biology and Genomics. And that really allowed me to focus all my efforts towards generating new knowledge, contributing to new knowledge, and advancing the field in one way or another. And I've been really fortunate that throughout my academic journey, I've engaged with a lot of people, a lot of researchers, scientists, that have kind of shaped my thinking, shaped the research that I'm doing. And on the back of that, then the idea for the company really came very naturally to us, because we realized that we have great technology available at the university level. We have people that are desperate to find answers about their own reproductive health, and then there's a market around it. And as part of our mission, we do want to fill that gap and to enable people to, I guess, find out more about their reproductive health and feel that they have heard and listened to.
What was your childhood like? Were you always thinking about growing up and becoming like a CEO of a company? What was your childhood like?
Interesting. I think my childhood. So I'm from Moldova, so you're used to Europe, right? So it's a very different environment to grow compared to obviously the West. But what I was fascinated as a kid was that I always liked questioning everything, and I think I was always very interested in the diversity that we have within us as humans, but also the diversity we have in plants and animals and things like that. And funny enough that you asked me this question right now, because I remember that when I was, a kid, literally from the age of 5, I started having a lot of pets, like birds, hamsters, fish, tortoises, you name it. And what drove me to all of them is I really tried to understand how I could create a good environment for them so they could reproduce. So somehow at the age of 7, I was thinking about reproduction in a way that, you've got to provide the right environment, the right nurturing, facilities and care and food and things like that. Because for me, reproduction at that age seemed like the ultimate, I guess, goal for those fish or for those birds that I owned. To an extreme that, I once had hamsters, and I had 2 hamsters, and then those 2 hamsters became 30 plus. That was
the whole farm,
exactly that. So I think my questioning, and I was very curious as a kid, so I always looked at things, and I think that questioning remained with me. And then as I progressed through my academic journey, I started asking deeper questions, and I started addressing them, and I think that really led me to the place where I am now.
Why do you think that fertility in men is so much taken to the background? Because I hear a lot of stories about women, right? And how they are not obviously fertile and they have issues with, especially coming from a black background. I hear stories like that. But I barely hear stories about how male are having problems with their fertility. So why is that the reason? What is the cause for that?
Oh, there's so much to unpack here. It's great. It's a great question. I think men's health as a whole has been neglected by men, by doctors, by research, and by everybody really. And the main reason for that, there's several reasons, and it's highly complex. But I think we need to first of all talk about the differences that we have between men and women. And I think if we look at the very basics, and the very basics are, life expectancies, for example, we know that men worldwide live, we live shorter compared to our, partners. In the UK, that difference is about 4 years. In countries like Moldova, like East of Europe, actually, it's about 10 years. In the US, it's 7 years. So the age is just massive. The gap, the age gap between longevity between partners is massive. And that has, societal explanation, that has biological explanation, medical ones. In terms of behavior, obviously, as men, we are expected, and we've always grown with this ambition to be the providers. And a man would do anything to provide for his family, right?
Yeah.
So you would engage in, risky behaviors. You would engage in jobs that perhaps put your health at risk, just to be able to provide. Also, another element of that is that we as men, we don't engage with healthcare system in the same way as women do, right? And that really leads to, I guess, to a decline in screening, which results in a decline in diagnosis, and obviously delayed treatment and and costly treatment, actually. So I think this is one of the reasons is first of all, we are a lot more adventurous. We engage in risk-taking behaviors, but also we don't engage as much with healthcare as we should. And that is really reflected in our overall health and longevity. But also when it comes to fertility, it's exactly the same. Arguably, it's even more sensitive because fertility is so much linked to our own masculinity and almost existence. Like it's taken for granted that we are one day going to be dads, and if that's threatened in any way, then our own existence is threatened, which it shouldn't be, because infertility is just a medical condition. Which, by the way, until recently it wasn't categorized as a medical condition. It was thought to be something different, but now it's, according to WHO, it's a medical condition that we've got to diagnose and treat.
Yeah, you said it was thought to be something different. What was the thinking for that?
Oh, because with conditions, you generally think about cancer. You think about liver conditions and things like that, or cardiovascular disorders, which have been characterized and have got protocols to diagnose and treat them. Whereas with infertility, it's just this almost gray area, and certainly that comes to we'll talk about it when it goes, for example, to regulatory approval. Things within fertility is really, there's a really gray area whereby we are not really sure what classification would a certain innovation fall under, because we're not dealing with a life or death situation, right? So you're not dealing with cancer. You're dealing with something that people believe it's people still believe that reproduction is not a must, and it's like almost like a choice. But in fact, if you look at our basic needs, reproduction, we are all here because of our parents, because they have this urgency, and we all have this urgency to reproduce and propagate our genetics, our identity, essentially. And when people are devoid of that, then there's a lot of psychological complications.
Studying to become a doctor is one of the things that takes a lot of effort. And obviously you're a doctor, you've done your research, and obviously you're training other people as well. What is that journey like, becoming a doctor and going ahead to obviously do your research to train other people? What is that journey like?
Sure. It's very interesting, and I think this is why I kind of decided to pursue a PhD in the first place, because it really enabled me to think outside the box and be different. And I think as a kid, I always wanted to be different. At some point I remember when I first had a smartphone. I had a Samsung, and that was many years ago, and the phone, even the clothes I was wearing, I was always different. So I think within my research, I really wanted to find out more, but at the same time I wanted to look at a place where nobody else was looking at. And I think for me, fertility just seemed the perfect space. I started, and this passion really came from my master's at UCL, where I was being taught about all these concepts around fertility. And at the same time, I was taught that fertility affects 50% of men and 50% of women, as in the causes of infertility stand with both partners. Yet I received 95% lectures focused on female fertility, which for me, the only lecture I had about male fertility, obviously I had many questions. And at the end of the lecture, I remember I asked the clinician, it was a doctor, how do you diagnose them and how do you treat them, most importantly? And he was like very blunt and very, I guess, dry. And he told me that you just do basic semen analysis sometimes. And the only treatment is ICSI. And just to unpack that, ICSI basically means that you take a sperm and you inject it directly into the egg. That's not the treatment.
Yeah.
That's you're facilitating conceptions, certainly, but that's not the treatment. And I think for me, I didn't want to kind of accept that, and I wanted to find more about it. So then I started my PhD, and I started working with different people to unpack that more and to understand, what's the answer behind that.
Yeah, and have you found the answer for that?
Yeah, I think it's something that we are constantly looking for answer, because with research, that's I think that's the joy about it. You start asking one question and that leads to another one, and I think this is how I've got into the position of first of all working with clinical samples with patients, because my research started actually with zebrafish and with mouse. I've also been doing research with oysters and other invertebrates, and what I realized was that there's so much similarity between us and all these animal models, and it's a shame that we in the medical community we often neglect the research being done on animal models, because it's highly informative, and it's being able to translate that into medical products for people to use, and obviously validating them across the timeline, that has extreme benefits for everybody, really.
There will be an uncommon similarity between an oyster and man. Like, will be one similarity that is really uncommon that you can talk about?
Sure. When I talk about similarities, I'm referring mainly to how our reproductive cells look like and how they behave. And for anybody that looked at sperm, we've all known more or less how a sperm cell looks like. You've got your head, you've got a neck, and you've got your tail, your flagella. And in most species, that is what it takes to fertilize an egg. All animal models and all I guess across taxa, sperm and egg are the highest or are the cells with the highest specialization, which basically means that they are so differentiated that their only role is to reproduce, essentially. And the genetic information they carry is incredibly similar. Obviously, there's differences between species and between individuals and things like that, but the genes that code for reproduction, for brain development, for development of organs in generally, they're very similar between these individuals. And also the fact that we've got about 70% similarity with the zebrafish, and people don't know about that, which is amazing.
That's crazy. So a lot of times I hear a lot of people do research for a long time. So there are certain researchers that go on for like 100 years, right, 150 years, but no solutions are actually found. Yeah. So it just is an ongoing research for a very long time. Fortunately for us, with you're providing a solution to a problem that you identified at a very young age, right? So what now we're going to go into your business now. What is that solution that you are trying to provide for the problem, which is male fertility and male health in general? Because obviously you are a scientist who is using technology to innovate these changes. So what is your company all about?
Yeah. Let me go back to your first point. So the reason why technologies generally or research has been or is conducted such a low pace, I guess, take the example of vaccination. It generally takes about 20 years to get a vaccine approved. And that is because of many reasons. And one of the reasons, obviously, or one of the many reasons is the clinical validation, the safety and all of that. And that's justifiable, and we need to have that in place. Yet another reason is obviously the lack of funding that we have within our community of researchers and of scientists. And we see that when you have the right injection of funding, you can deliver solutions at much faster rates. And I think COVID is a perfect example. Suddenly we were able to produce vaccines in record time.
Short period of time.
Exactly. Which is, it's good. And I think now that we have that model and we know that what funding can enable, I think is about time that we start applying that same mindset and the same model to other technologies. And for us, what we found was that also the reason why we decided to actually look at, I guess, implementing our research knowledge and our research background onto a product, a physical product, is because we realized that in academia, things move incredibly slow. So it would take, 15, 20 years for a university to think about commercializing their science, mainly because this is how the industry operates. As a scientist, you are taught and you are trained to generate new knowledge, to publish, and to hopefully let one day somebody else pick on that idea and turn it into an innovation, into a product. Whereas for us, what we saw was that, I remember, it was in 2021 when I was in my third year of my PhD, and I was having all these meetings with my PhD, with my former PhD supervisor, and we were discussing about all these different results that were generated using zebrafish and using humans, and we saw the similarity that I was talking to you about the genes that overlap between the species, and we suddenly realized that actually our product and our idea of implementing that, it's maybe closer to reality than we ever thought. So we kind of decided that maybe let's start working on developing this further and start exploring what commercialization could look like, as opposed to just publishing on a research paper and then store it inside your drawer. And so in 2022 we decided to really focus on developing a self-testing medical device, essentially, for male fertility diagnostics, essentially. So it's a product which aims to really speed up the time it takes to diagnose somebody with infertility, because currently the main or one of the main reasons that the system is so fragmented and we have so many men affected by infertility is because it takes about 3 years to diagnose with somebody with infertility, which is a very long time, especially when you deal with infertility, which we know is a condition that affects people past a certain age. Then time is really precious. So what we're aiming to do really with this self-testing device is really to provide those answers much faster, as opposed to just waiting and hoping for the best.
It takes 3 years to diagnose infertility. And is it just men or women as well?
It's a couple.
In general?
Yeah.
Obviously, infertility is something that causes a big problem in families. For example, if you're trying to, get a child and you're not able to, it's almost like the blame is almost shifted either, most of the times women, right? So why is it taking 3 years to diagnose this situation in us?
Yeah. Well, because we bury our heads in the sand when something doesn't work. You still, when couples, we talk to many couples affected by infertility, and most couples would fall pregnant. Like 90% of couples should fall pregnant within a year of unprotected intercourse. If that doesn't happen, and most of them do fall pregnant, if that doesn't happen, then somebody should seek help, essentially assistance. However, women are generally more open to seeking help. Women have a history of going to the doctors, or asking for blood tests, for hormone profiles and things like that. Whereas with men, we don't have time to go to the doctors, because it goes back to our behavior. We are the provider, so we have to be at the job. We have to provide bread on the table and things like that. And this comes from data, actually. We know that men around the age of 40 are those that miss their appointments the most. Their NHS appointments, for example. And arguably 40 is that age where a lot of conditions like cardiovascular disease, arguably infertility as well, and liver conditions starts arising. And if you miss your appointments, obviously you're not diagnosed when you should, and then that results in higher costs for the NHS if you're going through NHS or private for yourself. So the main reasons I suppose why people don't engage with it is really sometimes the lack of awareness, because what we discussed previously is people often associate infertility as a woman's problem, because people think that it's my partner that carries the baby. The embryo is inside her, so it must be something wrong with her. Whereas it's not. I believe that there should be no blame. It's a condition that has got to be treated as a medical condition essentially. And I mean, I could talk to you about the reasons why that happens, but basically, if we are to dive and talk about what happened in the past, you have this great philosophers and scientists that once considered that we as men delivered a fully formed human inside a woman's body.
Yeah.
And if that, if that woman didn't remain there, then the problem is with the woman essentially. So obviously now we know that we don't deliver a fully formed human, and we deliver just sperm essentially. But that assumption that the female is a carrier, is an incubator, still remains. And men think that I can do whatever they want with their lifestyle. That it doesn't really matter, because there's a lot of sperm out there in one sample, whereas women, it's one egg. You need to be really careful. But ultimately, when it comes to genetics and everything, it's a 50-50 lottery, really.
Yeah. So let's talk about the technology and what you're developing. What are you developing, and what is the technology behind it?
Sure. So we are looking at developing a pipeline of products and services really to address male fertility from different angles. We believe that the main way to engage people with their reproductive health is by providing that care at home, essentially, as opposed to asking that 40 years old man to go to a clinic and to miss his work, essentially. And so for the past 3 years, we've been really focused on developing the self-testing device, which is a hardware, essentially, which is paired with software. And that device enables men to produce their sample at home. So receive the test via their mailbox, produce a sample at home, run it through our device that we've developed, and then use the smartphone to receive the results in a mobile app interface. So it's a test that is really meant to provide a holistic understanding about male fertility. So not only looking at sperm counts, but also looking at, how fast does the sperm move, whether that man has a underlying infection or inflammation, which, by the way, about 40% of infertility in men can be explained by an underlying infection, which even most clinics don't test that. So what we're aiming really to do is to create or to launch this product that aims to capture clinically relevant parameters and provide men with answers immediately without having to go to a clinic or without having to post samples back to a lab to find out more about their reproductive health.
So when they get when they have their app with them and they do the sample, how do they solve the problem? Does your company solve the problem for them? Like, how do they go through the stages of making sure that they become fertile again?
Yeah. The first stage, obviously, within any fertility journey is understanding where you're at, and having that screening and having that diagnosis. And after you have that, then we can work out what are the reasons behind it. Is it a count problem? Is it a motility problem, or is it an infection? If it's an infection, then we can prescribe you, or you can be prescribed an antibiotic, for example. If it's a no sperm problem, as in no sperm whatsoever, then it's very likely that you'll need fertility treatment, like in vitro fertilization, for example. And so therefore we can then, advise you on that journey, and we can work with healthcare providers. We can work with private clinics, with NHS, and offer you that service to make sure that you get almost, I guess, fast-tracked, and you get seen by people that know how to address that from that angle.
Yeah. So is this going to be part of the functionalities of the app at all?
It will, yeah. The aim is really to provide an end-to-end platform, ultimately. Obviously, that is a very big aim. But that's our vision, is to provide an end-to-end platform to enable every man to be able to find answers about their reproductive health and most important, actionable insights, because this is what we want, and treatment solutions, essentially. But the first step for us is to be able to develop and deploy the technology to identify those issues in the first step.
Yeah. And what is that? What's the success rate so far? How is it going so far?
Sure. So as with any other, I guess, novel technology that you hear all the time. It takes time, and certainly in science it does take time. And we've been focused on really developing. So our test is a chemistry based test, right? So it's all based on molecular biology and chemical reactions. So we've spent the last 3 years really making sure and optimizing the formulations and composition of the reactions to make sure that we are happy with the results that we're getting, because ultimately, our test has to be equivalent to the gold standard, and the gold standard, unfortunately, is still the microscope. In fertility here. So we spent the last 3 years really working really hard with fertility partners, with men, with clinical samples, to make sure that we've got that validated. And we are now at the stage where we have a prototype. So we are currently undergoing validation testing, really with the aim to hopefully launch early or mid next year.
Okay, that's great. Went so well, is always good to re-energize ourselves to go back into it. So let's go back to what we're talking about. So you mentioned about the fact that it's taken you guys 3 years to build this product. Yeah. And what stage are you at the moment?
So we are at validation essentially, and validation basically means that we are currently testing our product against the gold standards, and gold standard, unfortunately, is still a person sitting under a microscope and counting cells manually. So that's the gold standard in fertility care, unfortunately, which is, I think, quite shocking for most people, because you think that maybe you have advanced machines, advanced technology to look at fertility, but that's not the case. And so we are currently exactly that stage. So we are comparing our device against the predicate, which is the microscope, to hopefully then gather all this data and be able to submit our product to regulatory approval. That's the aim.
How big is your team? Because this requires a lot of work and effort. So how big is your team? How many people are you working with at the moment?
Sure. So we have a multidisciplinary team. So we have 2 co-founders. So it's myself and my co-founder. She's a professor at the University of East Anglia with a background in research and diagnostics. And we are supported. So we recently welcomed a commercial lead. So we are supported by a broad range of advisors, ranging from people with expertise in software, expertise in legal, in medicine as well. And then we have partners that are helping us, develop, or not develop, but test the product and try and I guess validate some of our own findings. So it's us two, and then people kind of helping fill the gaps that we are not incompetent. That's a terrible word.
Missing?
That we're missing. Exactly.
Yeah. Okay, so obviously, as a tech company as well, we develop products, and sometimes it takes a very long time for us to get products developed. But one thing is that you may have a plan and have a reason to accomplish the plan, but the means of accomplishing that plan becomes a big problem. So, for example, we're developing like different apps that we're going to launch this year, but then it gets to a place where you need funding to actually propel what you're trying to achieve. So that is a big thing for a lot of founders and a lot of CEOs. What is that like for you? What is that? I want to know.
Yeah. That's a good question. I think that's an extremely relevant question, because when it comes to diagnostics and when it comes to healthcare and developing hardware, first of all, it's I've came to realize that it's very expensive. It's very expensive, and I think people are very, especially in the investment community, I think they're very reluctant because of many reasons. Because of previous companies that haven't been quite as successful as they promised. Because of regulatory hurdles, and because of unknown, and nobody knows about the field, nobody talks about it. And they're just not familiar that there's a market, essentially. So for us, we've been fortunate to be supported by our university quite a lot. So we are a spin-out from the University of East Anglia, and we received, thankfully, many awards and grants from the innovation department, but also from the Medical Research Council, which arguably, is. Medical Research Council was and is one of the biggest supporters of research around medicine and things like that, and that has been our main source of funding so far. So kind of applying for all these different grants and getting all these awards to then channel this funding to deploy to develop the technology, not deploy it, to develop the technology. And in the meantime, obviously, we are engaging with angel networks and VCs, so to understand, what their appetite is and to build those relationships, and so on, to be able to hopefully scale the product when the time is right.
Okay, so obviously you said you're planning to launch sometime mid of next year.
Yeah.
What do you have a date in mind, and what is the marketing looking like for that?
Sure. Date in mind, I mean, it's very hard to say yes. When we started working on the product, we thought, because we had, the core technology as such, is we knew how to do it, and we know what it takes. And we initially thought that we would, I guess, launch the product even this year. And we quickly realized that, there's a whole process, which, it's very different. Launching I guess, a medical device or an in vitro diagnostic device is very different to working with the same device in a research environment. Mainly because of the, I guess, the implications of providing those answers to people, essentially. And, regulatory process is one of those steps, which, we are fortunate enough that for us, the regulatory process doesn't look like that tedious. And what I mean by that is that it's not going to take years. It's going to take months to get that device approved. Mainly because we have, because of female health, we have a category, and our device would fall under that category. So there's no male category in the in vitro diagnostic. We have the pregnancy and women's health category, and we fall within that. Yeah, it's relatively straightforward to get that. So hopefully next year, mid 2026, hopefully we'll get that regulated and prepared for launch.
And to scale, how much do you think you're looking for to scale the product? So like everyone gets to know about it. How much?
Sure. So we've spent an awful lot of time in preparation, obviously, in coming up with our financial business plan and our business plan and things like that. Obviously, we are still sorting out our go-to-market, and it's as with any other business plan, as you know, it's a constantly evolving document that changes almost every week. There's not changes, but it gets refined essentially. And what we know is that we need $1 million to really take the product to manufacturing and to soft launch it, essentially. So the hardware, the software, and things like that, and then for proper launch, and that's another funding.
Have you found any obviously VCs or angel investors who are interested in obviously putting money behind this project?
Yeah, we are due to close our first investment round. Hopefully this month.
That's great.
Which is fantastic. Thank you. Because it's been, we've been trying to communicate our mission, and we've been trying to engage with as many people as possible. And what I realized is, it's definitely not easy. But I think having that resilience, once again, as a scientist, having that resilience, having that why behind it, that enabled both myself and my co-founder to remain focused and to remain true towards our mission, because what I found through networking and through having meetings with VCs and people with potentially financial that would open financial opportunities for us is that people have a lot of opinions about what you do or what you should do and things like that, and it's very easy to get distracted. And I think especially when you lack that expertise in the field, then you might think that maybe we should take a shortcut and we should do this differently. Whereas for us, we knew very much from the beginning that we have a roadmap. We've got the right team around us that helped us build that roadmap. That people that knew how long it would take and how much money it would take to take the product through validation, testing, to regulatory approval, to employing somebody, marketing, sales, and things like that. So once we've done that preparation, and we spent probably about 2 to 3 months doing that preparation with somebody who has a background, a background in financial services and around this area for the past 20 years. And after we've went through that exercise, then we kind of became confident that actually this is exactly how much we need, and this is exactly how long it would take to reach that point.
So sometimes when you're developing things and the products are about to come out, you have a plan of how you want to roll things out. So have you got a plan on how you're going to roll out the product for the global market?
Sure.
What is the plan for that?
Yeah. For us, what we really want, and that might seem naive, I think, but we really want this product, at least this first product, to be over the counter, meaning that we would ideally want this product to be direct to consumer, mainly because we see it as a preclinical step towards helping somebody find answers about their reproductive health. So like, pregnancy tests, when it first came, it was seen, everybody was reluctant, and because obviously that's triggers some emotions in doctors and in patients themselves. But then it got adopted so fast that pregnant women were no longer going to doctors to do the ultrasound or the examinations, essentially. So for us, that's the ultimate mission, is to really provide this product directly to consumer and enable men and couples to have access to that technology, essentially. Because once people get into a fertility clinic, then there's microscopes, there's technologies to look at fertility, to assess fertility. But the main problem is that only about 5% of people can access a fertility clinic because of costs, because of the emotional associated with it, and because of many other factors. But at the same time, now being in business for the last 3 years, I realized, and we realized as a team, that it's incredibly expensive to do such or to execute such a vision or a mission. And we started really working on our go-to-market very recently, so it's still in development. And we believe that one of the first partners that we would have would be clinics, would be pharmacies, would be product distributors, essentially, that would be able to amplify our voice and offer our product as part of their services and as part of their own products. Mainly because obviously this institutions, these companies, these pharmacies, they have a customer pool which are familiar with their brand and with their products. And so we do want to start working with companies like that to make sure that we access more people at a lower acquisition costs.
So if a customer buys the product off the counter and obviously they download the app to obviously send the information through to your company, do they have to like subscribe to any services there to be able to do that, or is it like a freemium account that needs to be created?
So the product as such, at least the way that we are currently planning to monetize it, is that people would choose between 2 product categories. One of them would be an essential package, which would give you access to devices, essentially, for you to test your fertility twice, essentially, mainly because we know that fertility is highly dynamic, and when we know that sometimes it can be sometimes that there might be reasons and there might be causes for you having a low result in one day, then you test second day, and then it's all fine. So we've got to have that sorted and that in place. And then the second option is an extended package. And an extended package, we are currently exploring the possibility of integrating that within a subscription model, whereby we would provide men and couples with access to a certain number of tests over the course of 6 months. And on the top of those tests, we would provide them with consultation services that would enable them to act on those actionable insights that we would provide alongside the product in the first place.
So apart from the fact that men obviously have to go to work to bring food to the table, one thing you mentioned as well is that it's quite expensive when it comes to all these fertility journey. So is your product going to be the one that people, be able to say is affordable for me to, get this product, test it out, and then find out what problems I've got, and I've tried to, draw out the solutions for it? Is it going to be affordable for the public?
That's really the aim. So exactly, that's really the aim. And we want to create a product. Hence, we relied on our, own intellectual property. And when I say here, what I mean here by intellectual property was our background, our know-how on how to develop this technology. So we decided to rely on molecular biology and biochemistry, which is in the lab is very cheap to manufacture these products and to develop them, which then obviously that translates into less costs for the patients. As opposed to developing or having men go to a fertility clinic and paying somebody to do things manually, or buying a microscope to count things. So Definitely. So that was one of our core missions is to really provide us products at a really affordable price, so that men feel that there's no barrier, at least when it comes to costs. And they can test themselves, as easy as a woman would test her pregnancy levels.
Yeah. So an interesting thing as well to mention or to ask will be developing a product, and the product hits the market, or before the product hits the market, you've got how you want a product to be, the pricing and everything. But sometimes when you're looking for funding, for example, you're looking for £1 million, right? If you get the funding, the investors will decide that, okay, we want to make our money back as well. And then you decide, okay, we're going to try and put subscription to say £20 a month. An investor says, no, I want this to be £40 a month. How are you going to navigate that?
Yeah. That's a good question. And I think this is why we've been so selective when it comes to investors. And I think this is why it's taking us a bit of time, so a couple of months to, more than a couple, a few months to try to close this round, because we wanted investors that saw our mission above everything else. Obviously, financial returns are needed, but we wanted people that cared about what we're doing and cared about our mission and saw our long-term potential, essentially. And I feel that within, because truthfully, if you wanted to, for me as a founder and for my co-founder, it was never about the money. It's all about, helping those men get answers, essentially. And we are confident that we can deliver that because of our capacity, but also because we've done market research. We engaged with men and we saw how desperate people are for products like ours, because it takes 3 years to get a diagnosis, and when it comes to people having children, those infertile people that go through IVF, it can take up to 7 years to have a baby. That's a very long time. So for somebody in that position, they are willing to engage and they want a solution. And I get messages on the weekly basis, from on my personal Facebook, which is not open to anybody, but also on LinkedIn, on people asking me, even VCs. It's crazy that sometimes VCs don't want to invest in the company as such, but they come to me as an expert to ask me questions, and I end up answering their questions, which they appreciate, but then I don't understand that we don't. There's no fit because they do something completely different. So for us, it's been a bit of a journey to identify those individuals and those institutions that are aligned and that see the bigger vision that we have, because we are not here to exit certainly within 3 years. We do want to create further products, and we do want to deliver more value than a 3 to 5 years exit.
Yeah. So when people find out that they are going through a condition or have a condition, sometimes mental health comes to be a big play.
Yeah.
So if they take the product, they send it to you, and then it comes back with like a negative result, like how is the product? Is the product going to help them, or is there going to be some sort of consultation to help them mentally? What is the process for that?
Yeah. So we are currently developing our software in a way where it allows them to book consultations directly with us or with our specialists. And at the same time, we are exploring the possibility of deploying an agent that is trained on our proprietary data set to provide them with medically sound and I guess scientifically sound information, so that they can understand more about what it takes and why the results are like that. Because we know that delivering results has to be, or the delivery of results has to be done very carefully. Mainly because of what we discussed in the past, highly linked, fertility highly linked to masculinity and things like that. So what we're planning really to do is to, once the product is launched, is to really capture and understand what are people looking for in terms of consultations. Is it because we have a vision, we have and when it comes to fertility, there's different ways where you can tap into. You can tap into nutrition as well, because that's highly linked. You can tap into intervention, you can tap into mental health. So there's different avenues, and we have a pipeline and we have a roadmap. But the ultimate answer, I believe, will come only when we have that community of people using the products and asking for help. Essentially.
Have you got competitors at all?
Yeah, we are a few of us in the space, and when I say a few, it's really a few. So it's about 5 companies in the whole of the United Kingdom.
No way.
It's very small, and you know, that's why sometimes I get frustrated when I'm being told that the market is overcrowded, because I don't see it that way. And certainly, you know, I am aware of my peers working in the same space and trying to develop solutions that are tackling exactly the same problem. Yet I don't see, you know, competition is good. And I think, you know, we especially within healthcare, we need to be able to work with each other to really advance that knowledge and empower people. And this is certainly, you know, the way how I've been approaching my competitors as such. You know, it's trying to kind of work together on the same mission to address these problems.
Yeah.
Obviously, there's people, you know, developing medical devices. There's people developing consultation or specializing in consultation services and things like that. There's people specializing on home to lab delivery of samples and things like that. Ultimately, you know, I believe there's a market for everybody, really, because we are dealing with a massive problem. You know, 1 in 6 couples affected by this condition is massive.
It is. You're gonna start obviously the product from the UK. What is the global, like, what is it gonna look like global market wise? There's a plan for it too, to, you know, roll it out to the global market. What's the plan for it?
Yeah. So purely from statistics, we know that about, you know, 1 in 6 couples are affected by infertility, but we know that approximately 56 million men suffer from infertility worldwide. Obviously, the largest market is the US, and this is certainly something that we are considering, mainly because we know that infertility affects in the US, you know, it's exactly the same proportion. It's 50-50. You have countries like Middle East, for example, where it's actually 70-30, so more geared towards women than men. In Asia, for example, the situation is very similar. So it's almost a 50-50, but Asia is a completely different situation because the fertility rate there it's extremely low. You know, we should have 2.1 babies per family. In certain Asian countries, we are at 0.7. Which is massive, and that's dramatic. So our aim really is to once we launch in the UK, is to gain that FDA certification to then be able to launch in the US, because once we get that FDA certification, then there's other countries as well that accept the same approval, essentially, so that we can start the rollout.
Whereas I know you're doing research in the UK, but would you rather like launch it in the US before the UK if you had the opportunity?
Yeah, that's a good question, and it's certainly something that we get asked. I mean, the main reason why we, I guess, decided to start in the UK was because we know the market quite well here. So we know clinics as researchers. We have the contacts, and we have the network of people willing to support us, essentially. In the US, it mainly comes down to funding, really, because in order to be able to sell in the US, you would need to have you need to have FDA, at least for our product class. And to get FDA, you need to have your clinical trials in the US. And doing clinical trials in the US, that comes with funding, obviously.
Yeah.
Funding gaps and things like that. So that's why for us, it just felt natural to first use the UK as a launchpad.
Yeah.
And then kind of explore the US, explore the Middle East, and other countries after that.
Okay. This is a really good. What's the right word for it? I've understood more what like fertility in men is like, and obviously the solutions that you're trying to provide. The fact that it's going to be now easy when the product comes up on the market as an OTC, where you can just pick it up, run whatever test that you need to test, and then go through the app, and then you'll be able to offer consultation to help them provide solutions for it. So I think it's something that is definitely innovative, and is going to solve a lot of problems, especially in marriages, families that are looking for children for a very long time, and it takes almost like the blame is only just on the woman. Meanwhile, it's probably the fault of the man, and the man has no reason to go and check whether they are fertile or not. Yeah. So your product is definitely something that will definitely solve a lot of problems in the world. Are you excited about that?
I'm very excited, and I think beyond the product, what I'm mostly excited about is being able to deliver education to all of, because with a product there's a lot of education coming through the app, through our interaction with the customer, with the men, with the couple, essentially. Because ultimately, I do believe that education is ultimately the ultimate empowerment of men and of couples. Because you'd be surprised how many stories I hear of men. I traveled. I told you off camera. I spent about 6 months in South Africa, which is completely different to how things, the cultural differences, the attitude, and obviously the funding available to anything. But I was shocked at how little education people had around fertility, and especially men, and how much blame they had from their partners, from their families, because under their eyes, their main purpose was to sire offspring, which is very, I guess, what's the word? It's very primitive. It's but it's a natural instinct that we all have, right? And I mean, I do remember conversations that stuck with me until now. Is a driver, a Uber driver, once shared with me that he has. I told him what I do, and then once I tell people what I do, then they open up crazy stories and they tell me what tried. And sometimes I hear stories. Certainly in South Africa, that was very common. I've heard stories of couples not being able to conceive, and then suddenly they prayed, and then something happened, and then the woman fell pregnant, and then they tested again, there was no sperm, and I was like, okay, I'm not going to talk about it, right? Okay, you do you. And then another story that I was very, I guess, touched by was when a man shared with me that he has 2 daughters, and it's taking him a few years to get the daughters, maybe because they had some sort of infertility. I think they're trying to conceive like for a year and a half, and they couldn't, but then eventually they had two daughters. And yet, despite of that, he was still blamed by his wife because he wasn't able to provide her with a son. And his wife was kind of blaming him because he was not man enough, or his sperm was not competent enough to to sire him a son. And he was like, the daughters were, one of them was 7, another one was 11. So 11 years living and hearing that blame every time, it's just draining, and
crazy.
Exactly, and and this is how you'll now understand why men are at 4 times higher suicidal rates compared to women, because there's a lot of pressure happening at the same time as as we leave our jobs, and as we engage with our families and things like that. And then, I had a conversation with this man, and I told him, actually, I explained very basic biology, and I literally, told him very directly that, it's really a lottery. It's not about you being a man, or you being, it's or not, or you being masculine or not. It's really a genetic lottery. There's 50% chance of you siring a female or male embryo, essentially. And then he felt so relieved. Like, he told me that I'm going to go home and tell my wife that I spoke with a doctor with a PhD, and I just felt good, because I saw how empowered he felt after hearing that information. And I think this is, and there's many more examples like that. And I think this is ultimately our mission, is to deliver products, tools, services, but most importantly, education around these issues.
Yeah, I mean, that's wonderful, because in as much as there's going to be money involved, and obviously as a company you're going to make profit of it, the core of what you're trying to do is to provide education and to help people get the understanding of what fertility is like in male, and obviously general male health as well. So before we go, is there any sort of is there going to be any inclusivity of general health included in the products, or is it obviously it's going to focus on fertility, but what about other health problems with male?
I love this. I think people don't realize that sperm health is an indicator for your overall health. So we now have incredible amount of data. I mean, there's been a study very recently published where they've looked at 80,000 men in Denmark, and they've looked at their semen levels, essentially, and they correlated their semen levels against their life expectancy, and also against disorders that they developed, essentially. And what that paper found was that men with higher quality sperm, so more sperm and sperm that move faster, they live about 3 years more than men with poor quality sperm. Men with higher quality sperm are also at decreased risk of developing cardiovascular disorders, metabolic conditions, diabetes, and things like that. So fertility is really just a window for overall health. And when I talk about male fertility, what I'm wanting really to, the message that I'm wanting to convey is that this is not only about fertility, but men's health.
Yeah.
And men's health has been neglected for many years. You know, you look at scientific publications, you know, you just look at data. You see that last year in 2024, there were 1,000 papers published in men's health. You just do a basic volume search analysis on the searching platforms, 1,000 papers. Compare that to women's health research. Women's health research, there were 24,000 papers being published. The last time women's health research had 1,000 papers published was 30 years ago.
Wow.
So I think, you know, this is just evidence that, and the same comes with funding, by the way. There's, you know, we have more projects, which is great. You know, female health is incredibly important, and it should be funded and it should be addressed. But at the same time, we should not forget the other 50% of the equation.
Yeah, I mean, data over dogma every single time. And what I would say is the fact that this information is going to be published, and a lot of people are going to be aware a little bit more about male health and male fertility. And I think it is a chance for every male to, you know, get this product when it comes out, because it would definitely help you. Because remember, the fertility health is what determines what other issues you also have as well. So the product's going to be out sometime this year, and when it comes out, I'll encourage everybody to go and grab the product when it comes out. Do you want to say anything before we go? Is there any last comments you want to pass before we leave?
Sure. I mean, just to kind of reiterate, I think I completely agree with you. I think we should be engaged with our fertility, and you know, I'm extremely excited about our product, mainly because I do believe that everybody should test it, and not because, you know, but mainly because we need, you know, at least know your baseline levels. Maybe everything is fine, it's great. If everything is fine, then you at least you have your peace of mind. But don't just assume that everything is fine, because a lot of the time it's not, essentially. And the earlier you pick up the signs, the more you can plan your future. You can plan, you know, you can start planning your job, because a lot of the time, you know, this is very much dependent, and people want to progress on their careers and they neglect this side. So definitely at least know your baseline levels, and then see whether that's, you want to engage with it further or not. If not, then we are happy.
Yeah,
you know.
Yeah.
But thank you very much for the chat. I loved chatting to you.
Thank you, Dr. Daniel.
Thank you so much.
Yeah, pleasure. Okay, so this has been a Recon podcast with myself, Amandla, and this conversation is a very good conversation that I would love all of you to listen to. Please do me a favor by liking and subscribing to our channel, and I'll see you on the next episode of the Recon podcast. Thank you.